Good afternoon, everybody. Thank you for joining us today for Second Harvest Heartland Agency Online Exchange. I appreciate those of you who are here, and I know other people are going to be joining us shortly. So just as a reminder to folks, we want this to be a space where folks can connect with each other and learn from each other. So one of the ways that we like to do that and make sure folks are connected is by making sure that we have in our names displayed through Zoom, your name and your the food shelf or the entity that you're representing. And if you want to throw in your pronouns like I have on mine, please go ahead and do that. Otherwise, if it's easier for you, if you can just throw your name and email and maybe your title in the chat. I know some people will be able to go through then and connect with you later. If there's something that you wanted to discuss, you'll have that contact information with each other. And we'll always send out transcripts of the chat to folks once we're done with this. So thank you. We're going to be going through a few things today. Roel Ramos, our trusted agency compliance specialist, is going to go through some changes to TFAP documents that are going to be going through. Then we're going to go a little bit into discussion of what are recommendations for food shelves with regards to masks. And then we're going to follow that conversation into one, we're going to learn from some of our partners about how they've opened up, how they've welcomed folks back into shelves, how they've adjusted or what they've kept from some of the processes that they had to introduce during the earlier part of the pandemic. And then we'll just want to hear from y'all about what are your challenges, what are your concerns, what are some things that you want to learn more about from those folks who have already opened up to folks. So without further ado, then I'm going to pass it over to Roel Ramos. Take it away, Roel.
Good afternoon, everyone. As Francisco introduced me, Roel Ramos, I am the compliance specialist, one of the 3 compliance specialists for Second Harvest Heartland. And I'm just going to take a brief moment to go over some of the new updated TFAP material that DHS recently rolled out, and you have probably received the communication if you're a TFAP program on our behalf. And let's see, do I have capability of sharing, Francisco?
You should be now. I made you a co-host.
Oh, perfect. And so first document that we're going to touch on briefly is the intake options for TFAP food shelves or distributions. Can everyone see my screen?
Yes.
Yep.
Perfect. And so TFAP has modified their intake process a bit to make it easier for distributions, right? Especially given now that a lot of programs have gone through sort of a drive-through model. And so this helps simplify that process. And so if you take a look here, your agency staff and volunteers, they must still provide and or post the federal poverty guidelines. They must still provide or post the data privacy policy, post non-discrimination statement. You're still required to track household information at each food distribution. You will be still required to do the civil rights training and then adhere to the TFAP record retention, which is 7 years for TFAP records. Additionally, you must post these resources, posters, okay? So there are the SNAP resources, voter registration material must be available, the interpretive services poster, and then the Injustice for All. This is a shortened list of your regular TFAP requirements for required postings. Traditionally, you're asked to provide also the grievance procedure, your ADA policy, and so some of those things have been approved to be left out during for this updated intake process. And you can see here there are for this TFAP intake process, you are not required to have folks fill out the TFAP eligibility form or sign the data privacy. And then you will ask participants to verbally verify that they are still eligible for TFAP based on the income and their physical presence in Minnesota each time a food is received. Or at the time of annual intake, notify the household that they are required to self-disclose income changes that may affect their eligibility. And so here we see at each distribution, food shelves you must post the federal poverty, the data, the non-discrimination, and then you will be asked to collect head of household name, head of household address, and the same children, seniors, and adults, and the pounds. You'll see here an example of intake, right? And so a change is that previous to this intake option, TFAP asked only for a zip code. Now they are requiring a full address. And then as well as pounds distributed here. And so they are keeping the 300% federal poverty. So that is the intake. Any questions on intake options for TFAP food shelves?
Yeah, question about permanent addresses. What do we do in the event that somebody who comes for our services does not have an address?
You could just write in homeless. If it's a homeless client, or I know that if it's a client who is homeless, you would just write homeless on there. In a situation where I guess if they're maybe
because we do have some clients that are currently bouncing between motels or shelters.
I'm gonna go into meeting. No, you're good.
I would say their last known residence, because yeah, either that, or if you want to list them as homeless, that'll suffice.
Okay.
For the address portion of it.
Okay, thank you.
Mm-hmm.
So Roel, I've got a couple questions in the chat for you. So Jamie asked, where can we get an updated interpretive services poster?
Let's see. It's not posted on the Hunger Solutions website where most of the other required postings are, but I can go ahead and send out. I have PDF version that you can print out on your own, and I can definitely send that out to Jimmy if he needs it.
Okay, great. We also have a question. So do we not have to fill out the regular TFAP form? I think that maybe Nita, you were not a part of this. So these are the updated TFAP forms. So this is now the regular form as I understand it. Greta asked, what are the requirements for mass produce distributions? Will that stay as we have done in the past? From Greta.
Yeah, so this is intended to be the you can still very much use the traditional TFAP form if you like. That is still an option. This is more towards geared towards those types of distributions, mass distributions.
Oh, okay.
Greta, can I ask a follow-up question? Are you distributing any TFAP products at your produce distributions? Okay, these requirements are only for programs that are actually distributing TFAP product.
Okay, thank you.
Correct.
So in fact, Heartland, we don't require you to do any kind of intake if you're not distributing TFAP. Although we do still want the statistics, number of households, children, adults, seniors, and so forth.
Right. So we're still collecting that data, and we would continue to do those in the same way that we always have.
Yep.
Yep. Okay. Thank you.
Perfect. Yeah. Perfect. So then I will now share
Sorry,
other. Yeah.
one more thing. I didn't see this question before. What do we put down for an address if the client is here illegally?
So essentially, so this is all based on self-declaration. They can put down any address they like. And so we don't request, you cannot request identification. And so this is all on self-reported. And so, yeah, we don't check any documentation at all. So we're taking them at their word for it.
Got it. Thank you.
Perfect. Then I will just quick share the okay, 1 second here. One second, I gotta get my screen here. Okay. Okay, so this is the 2021 through 2022 TFAP eligibility form. And again, one of the main changes, which didn't change from last year, you would notice it would be the federal poverty guidelines on this. So not much has changed to this form. Any questions on the eligibility form? Nothing in the chat, Francisco? Okay, perfect. Now the other change that sorry, I shared the wrong screen. Here we go. The other change that or update that DHS has updated is this eligibility form, right? And so it used to be on annual income solely. Now they've added a chart for monthly income. So that is an update to the eligibility. Any questions on the income eligibility?
And Roel, do they have to provide any sort of documentation of this?
None at all. None at all. No check stubs. No, nothing at all. It's solely on honor system self-reporting. Yeah. Perfect.
So does this form just go? This is the form that stays on our table. Is that correct?
Correct. Yes.
Okay, I have that on my table. Okay.
Excellent.
Yes, you would want to have this posted as one of the intake options if you're not using the eligibility form, the traditional form.
Yeah, I got this posted on my, because I use the pantry saver system. So we've already had like all this integrated. So, okay, thank you so much.
Yeah, not a problem. And then just quickly, I will share the last. So these documents, again, this is for the non-traditional intake eligibility form. You would want to post the data privacy notice either on, just make it visible somewhere during the distribution. And so these are meant to be printed out. That way you don't have to have the whole eligibility form, the TFAP eligibility form. This is much better to post. So essentially, this is all you would need for that updated TFAP intake option. Any additional questions?
We had a couple in the chat, Roel. So Michelle asked, he said, with reference to you, we cannot request an ID. Did he mean we cannot require an ID?
You cannot require, that's right. Apologize, word, yes, yes, very specific. You cannot require, no one can be turned away for not having an ID. You may request, but you can never turn anyone away for not being able to provide, even if they don't want to provide one.
Got it. Thank you for that clarification.
Yes, apologies on my end. We have to be very clear on that.
No, I know, yeah, it's really specific with these words. We have some lawyerly folks in the chat.
Nice, nice.
Which is good. We love attention to detail. So Katie also asked, are translations of the updated forms available?
Only
the link.
The only ones that I have received are the TFAP eligibility forms, and those do come in different languages. But these updated postings that only have the data privacy and then the eligibility, the income eligibility, I have not seen those in any other language.
Got it. I'm sure they're working on those, and so as soon as we know, well, I'm sure they'll send them out too. But we'll also make sure, especially as a follow up to this.
Definitely, and any communication we receive from DHS, we always send out communication to our partners as well.
Kathleen asked, with regards to the self-declaration of eligibility, is this gross income or net annual income?
Oh, good question. And I did not do my homework on that.
I'll jump in. I'm pretty sure it's gross income.
Thank you, Lisa.
Thanks, Lisa. Janelle asked question about TFAP. I jumped in a few minutes late. Here at Clues, we don't have a weight scale. Can we give an estimate of the pounds of TFAP each participants receive based on the pounds of the invoice?
You can definitely give a good estimate, yes. Based on clients and pounds distributed, yes, and on an invoice.
Good, thank you, Roel. And it looks like that's it for questions. Does anyone else have anything that they wanted to ask, Roel?
Ariella Garcia? She said that this one is, she's 60 years old? No.
I don't think that was for you, Roel.
Okay. Well, if you, I'll throw my name and contact info in the chat. If anyone thinks of any additional questions, feel free to reach out. And Jimmy, I will send that interpretive services PDF your way.
Awesome, thank you very much. And I got a private message, but we are going to make sure that we have the recorded link to this sent out to all of you after this happens. So just if you did come in late and you wanted to review the TFAP stuff, you will have access to Roel's presentation. Great. So again, thank you, Roel. I wanted to now move on to a conversation, or at least walk through with you some of the guidelines that have been put in place, or just sort of recommendations, masking guidance for food shelves that the state has put out there now that more, that mask mandates have been lifted. People are still kind of confused what should we be doing. So I wanted to go through really quick some of what's been written, and then use that as a way to talk about what y'all are doing. So as most of you are aware of, the statewide mandate to wear masks indoors has been lifted, but local governments, companies, and settings are still permitted to establish requirements for masking indoors. I'm not going to read through all of this because I think we can just send out the link and give people the opportunity to read it over themselves. But the main takeaway from this communication is that masks continue to be recommended regardless of vaccination status by the Center for Disease Control and the Minnesota Department of Health. I know, especially when it comes to folks that we're typically serving who may have for one reason or another be particularly vulnerable, I think it's just really smart. And what the CDC and Department of Health are saying is that it's just really good to continue to encourage people to still come in with masks and establish their own masking protocols within their settings if they're not already. This kind of goes through the consequences of not wearing masks, as you might see continuing unknowingly even the spread of COVID-19. And then it says the safest course of action for food shelf settings. Again, it doesn't change their public health recommendations, especially for the spread for people experiencing food insecurity and staff and volunteers supporting them. So continuing to help folks get vaccinated, wear a mask indoors when it's possible, is still what they are recommending to be best practice. Again, it could be hard establishing your own protocol, so hopefully we'll be able to share some of the things that we've been doing in order to help each other just instill best practices and make sure that we are keeping each other safe. So again, while I'll post this link, there is some more guidance from the CDC, MDH, and the considerations for food pantries and food distribution sites, and then some more resources for protocols that can be available through this. So I'm going to stop sharing, and I'm going to just post this link for folks who want that information. Oh, it's already in there, so that's great. Thank you, Lisa. But now I wanted to invite some folks to speak who we have talked to ahead of time, and they said that they would be willing to share some of the things that they're doing now that they have been opened up to the public, have more people coming in to their space. So I think I would like to start by welcoming Michelle Raschke to speak. So if you could just say your name, hopefully pronounced correctly, since I was just going for a guess there, and where, your shelf and a little bit about what you've learned, what are some of the challenges, and what you're doing.
Sure. Thank you so much for letting me share. I'm Michelle Raschke, and you pronounced it perfectly, with the Friends in Need Food Shelf, and we serve Cottage Grove, Newport, St. Paul Park, and Great Cloud Island. So like everyone else, we were doing the curbside pickup for the last 15 months. Starting June 1st, we decided that we were going to let people come in to shop. We had done some casual polls before that to see whether that was something that everybody was ready for, and they definitely were. So June 1st, we started letting people come in to shop. We did limit it to one person per family so that we don't have a whole bunch of kids running around exposing everyone else when they're not vaccinated. We did require masks for everyone, whether they were vaccinated or not. And then we kind of spaced them in the shopping area so that they were at least 6 to 8 feet apart while they were shopping. We had a hand sanitizer machine right at the doorway. We had the masks available there if they didn't have their own. People were absolutely thrilled to come back in and shop for themselves. They felt like they had been getting so much food because the way we did it during COVID was just give them everything plus the kitchen sink, and then they could distribute it at home to neighbors or friends or family if it was things that they didn't want. So now they were very, very excited to come back in. We did also offer deliveries, which we've done the whole time. And before COVID, we did rides and deliveries. We have not resumed rides. We are just delivering to those people as well. So we have a team that comes in just to prepare that. And then we also offered a one-spot curbside pickup for anyone who wasn't comfortable coming in, or someone who maybe had a whole bunch of little kids and they couldn't leave them. So they can still do the curbside pickup. And we have found that that is requested very little. Everybody wants to come in and shop. We'll have 1 or 2 a week that are requesting the curbside. And a lot of the deliveries, which we're having up to 8 to 12, are the disabled or anybody without transportation. So we're still doing that. As of yesterday, we did change to where if you are fully vaccinated, you do not need to wear a mask. Our volunteers are all vaccinated. And we did a casual poll the first couple of weeks we were open just to kind of get a feel for the clients. And most of them were as well. So, and like last night was the first time that they had that option if they were vaccinated. And we found about a third of them keeping it on anyway. And they would be honest enough to say, oh, well, I only have had the one, so I'm still waiting for my second one. So we were impressed with the fact that they weren't just taking them off and trying to, do it without. So it's going very smoothly. We love having our building being used for the way it was designed, which is a shopping model. We're lucky enough to have a building that's only 5 years old, so we were able to design it that way. And to get back to using it the way it was intended has really been good. The volunteers have very positive feedback because they missed interacting with the clients. And that's a big part of volunteering, is seeing that the people you're helping are excited about what they're getting. And that's been something that's been missing. So they're happy as well. We're integrating both the pre-COVID volunteers that are the most elderly and needed to stay home for that year, along with younger people that came in during COVID, that maybe their jobs went remote or didn't need as many hours or whatever. So we had a whole new volunteer pool that started during COVID, and now we're integrating both. We're having a big volunteer celebration dinner to thank both the ones previous and the ones who are new this last year, just to kind of welcome everybody back. But it's going very well, and I'm glad we opened up when we did. We were cautious. We still are following a lot of protocols to try to make sure everyone's safe, but they seem very happy.
Awesome. Thank you so much for sharing, Michelle. I just had a quick question about, you spoke to it a little bit, but can you tell me a little bit more about how volunteers have responded to, having people around it? It sounds like positively, but have you seen any fluctuations in how people show up or who's showing up or anything like that?
As far as volunteers, yeah, almost everybody's back. Some of them, their health deteriorated over that year, so they probably will never come back. And a lot of them are gone for the summer. They're golfing or they're going up to the cabin for the summer. So some of those aren't coming back. But yes, we're doing fine on volunteers between the old ones and the new ones. We're doing really well on that. And they just seem to be happier interacting with the clients. So that hasn't been a problem. Our numbers are down. So it has made it very easy for us to make this transition and do it carefully and slowly. And now it seems to be working really well.
Awesome. Thank you, Michelle. Appreciate you being able to speak to that. Another person who I wanted to introduce to everyone and to share their wisdom, as they've been open now to the public for quite a while now, is Patrick Felker from IOCP. So Patrick, can you share a little bit of your experience opening IOCP up?
Yeah, for sure. Pre-apologies, I'm going to repeat a lot of what Michelle said. I wrote it down because it was very similar to us, but I'm Patrick. I'm over with Interfaith Outreach. We're in Plymouth, and we serve the western suburbs. And we reopened back in October of last year. Very similar to Michelle, we just kind of pulled the folks who were using our services, and people just wanted to get back, but they wanted to get back safely. And so we introduced appointments for the first time. Traditionally, we were just open hours. Hey, we're open 3 to 6, just show up during that time. So we have gone to appointments, and we have 4 people in the food shelf every 20 minutes. That has gone really smoothly, actually. People, it might be something we keep doing, even kind of out of COVID. People have said it's a calm atmosphere in the food shelf. And they've appreciated that. Similar to Michelle, we do 1 person per family if possible. Obviously, some people have kids or people need have to shop with somebody, so there's exceptions there, of course. We have asked folks to keep their masks on, even with the mandates coming down and stuff. Obviously, we don't force anybody, but just with not knowing who is and who is not vaccinated being in our building, we have asked folks to keep masks on, like 99% of people do. And we still do like wiping down carts, having hand sanitizer available, all the kind of general health stuff that's probably good to do regardless of whether or not there's a global pandemic going on. And we also, once a week, we have a drive-through. It's, I think, maybe like 20 people use it total. So it's very small compared to our overall numbers, but there are still some people who don't feel comfortable coming in. And we also have expanded our delivery program, but we are seeing most people opt into coming and shop if available. And yeah, hugely positive feedback, echoing Michelle again. People people prefer to fill their bag with stuff they want versus us guessing what they want. So yeah, overall super positive feedback for this.
That's awesome. Thank you, Patrick. So we have a question in the chat. Patrick, how do you schedule people for their time? Do you have them call in or use an app?
We use Sign Up Genius, which does, I believe it's about there is a free version. We opted to pay. It's about $500 a year, and that you can get it without ads, essentially was our big thing. So we have ad-free Sign Up Genius. The link is on our website. We hand it out to people so they can sign themselves up. A lot of people do call in to make their appointments, and they just make them when they're in the food shelf. So they'll shop, they'll stop at a kiosk, and just a volunteer will make, okay, here's your next appointment in a week or whatever. And that's mostly folks with technology troubles, or it's folks who are not English. It's English second language is mostly who we're helping. Or people, it's their first time. If someone calls in and they've never been here before, they go ahead and give us a call. And I'll throw it in the chat here if anybody wants to look at it.
Awesome. Thank you, Patrick. I'm also curious to hear from you how people, especially folks who maybe came before when there wasn't appointments versus now that there are appointments, how are they responding to that?
Could you repeat that? Somebody just walked by me with a cart full of glass and I didn't hear a word of it.
I mean, that's part of the work you do, so that's going to happen. How are people responding to the appointments, especially folks who maybe started coming to the shelf when you weren't doing appointments?
It's been pretty positive. I think last October, I think people were just thankful we were open again. So it was kind of just like, oh, I'll make an appointment just to come in. But we have found it has been, yeah, pretty positive. Before with the open hours, it was nice because people could just show up. There wasn't a barrier there. But it was not nice in that if you're open 3 to 6, you'd have 55 people show up right at 3 p.m. and it was pretty chaotic. We didn't really have a means of like filtering it well. So it was just 50 people in the food shelf all shopping at once. So surprisingly positive. I didn't think it was going to go as well as it has. One thing we haven't done yet, but we will probably have some open hours at some point in the week. You know, there are some people that just appointments don't work for them, and you kind of need a space for them. But I'm probably thinking if we did it 1 day a week in the afternoon or something, we could get away with it. We wouldn't need to go full open hours anymore, but just to account for everybody's schedule. So we'll have something on there eventually.
That's great to hear. Yeah, I think that's a big, from what I've heard from people, is that's a big kind of tension on whether or not they're going to make that decision, because they know there are folks who need the flexibility of open hours, especially with things like transportation and stuff like that. And then also people who do prefer, I like knowing what my set time is. So I'm glad that you're considering both of those things. Margaret asked, do you get many no-shows?
Not a ton. I mean, there's always 1 or 2 naturally, but we did a few months ago, we were tracking our no-shows to see if they would like sign up later and show up, and they all were. So thankfully folks were, if they were not able to make like their appointment yesterday, let's say, they would make an appointment for tomorrow morning. Folks were kind of staying on top of it without us having to do anything for it. But Sign Up Genius, you can send automatic emails. And so we do have an automatic email that goes out to no-shows that just says, hey, we saw you couldn't make your appointment. Please reach out to Patrick here. Here's the link again, inviting people to kind of re-show up.
Got it. That's a cool feature. Nice. Well, thank you very much, Patrick. I'm going to pass it on now to Roger Raschke, who is going to talk about his experience reopening.
Excuse me, my name is Roger Raschke with the food shelf in Pipestone. And we started the in-person shopping. We're going to be doing that on July 8th. The reason for that is it's the first open day that we have after our board meeting, and I wanted to have the opportunity to speak with all of our board members before we reopen to the public. Our food shelf is operated by 17 churches and the Good Samaritan Society, and they are responsible for supplying the volunteers during the distribution. So every week, another church or nonprofit does the distribution. We haven't had any problems with missing people during the pandemic, the COVID close downs. People are volunteers are actually kind of anxious to get back to the old way of doing things. Our old way, we had just converted to a super shelf format in September of 2019, so we were only open about 6 months, and then COVID shut that down. So we're going to have to retrain a lot of people. We will not be asking for people to wear masks. If they want to wear masks, they're entirely welcome to do so, but we're not requiring it. Like other food shelves, we do have the automatic hand sanitizer available in the reception area. And what we're doing in the meantime now is, since we had about a month to get this going, we've been posting on our door internally on an electronic notification we have inside, and on our website that people are going to have to begin bringing their own boxes again. That's going to be an issue I have a feeling. And we're also resetting the food shelf a little bit. We're going to start carrying more culturally specific food items that we didn't have in the past. We're going to have to add some shelving. So we're in the process of resetting the food shelf, getting ready for volunteers and for our clients to come in. But as far as I can tell, everybody is just ready to go there. And like was mentioned earlier, we found that during the pandemic that we were actually supplying more food to individuals than what we normally do. Our per individual was probably anywhere from 5 to 10 pounds more per individual than what we did if they went through and picked their own food. But we went back to our pre-pandemic food list. Everybody got the same thing every time they came in. So hopefully we can cut down on our usage a little bit, our food usage. People will get what they want, and everybody will be happy again. And that's what we're waiting for.
Yeah, I hope so too, Roger. So what are you most excited about, and what do you think will be the most challenging parts of opening back up?
Well, I don't think it's really going to be a challenge. The customers are going to have to get used to walking the shelf again. That's the biggest issue. But I noticed when we made the change to super shelf originally, people weren't picking items by so many cans of vegetables, so many cans of fruit. They were shopping by department, so they could get so much for each department. And getting people and the volunteers used to that again is going to be our biggest problem. Otherwise, the masking and everything else is not going to be an issue.
Yeah, retraining folks into doing that and getting in that mindset will be
Right.
Fun thing for you to try on, though. I think that's going to be great. And what you mentioned wanting to have your board's approval, but what were some other things that you had to take into consideration before you said, okay, July 8th, this is the day we're gonna open up?
Well, the board members are going to be the people that get the volunteers to work their week. Okay, and we wanted to make sure that they're aware that masking isn't going to be required anymore. And most of our volunteers are older; they're in the late 70s, on into their 80s, and we even have some in their 90s working. We wanted to make sure that those people were going to be able to work without any problems. So that's why I wanted to talk to the board before we started on the 8th, and so that they could talk to their volunteers and make sure that it's going to be pretty much seamless going on.
Great. So yeah, it sounds like both talking to the board, but then also making sure that your volunteers are going to be comfortable and safe. And
right.
Great. Well, thank you for sharing that, Roger. I really appreciate you sharing your insight, and I'm excited for you to get up and running.
So are we.
Awesome. Thank you, Roger. Okay. Well, I wanted to thank everybody, Michelle, Patrick, and Roger, for sharing with us their kind of insights, what helped them make the decision, what they've seen, or maybe what they're anticipating as they kind of navigate this. And so I also was just wanting to open up the discussion to the larger group with just kind of what are some people's thoughts for those who've already opened? Like, do you have any things that you could share about what's working well, or what are some things that people might want to consider if they haven't yet? And if anyone hasn't made that decision yet about when they might have people back in, you know, is there anything you want to learn about? Is there anything that you want to, you know, bounce an idea off of? So. Yeah. Anyone, any questions for someone who's presented or just to the room?
I have a quick question. We've been allowing customers to make their choice of food anyway. We're not packing pre-packed boxes or anything like that. They're ordering off from paper, and we're also setting up an online service for them to be able to order. We do deliveries, so they can order over the phone and they can pick up. But we have a number of clients that like it this way. And so I'm curious if there are others that are entertaining the thought of continuing to do more of a drive up type of situation rather than to have them back in the buildings.
It's a great question, Greta.
This is Sean with Good in the Hood. How you all doing? That was a good question. That was my question as well. We find it's been intermittent a little bit. We have several pop-up sites, and so that makes it for some very convenient to have the drive or the curbside delivery, because they can just come and go real quick. That's a strong interest in those who are kind of in a hurry, or maybe have children, don't have daycare, and they maybe have their children in their car with them. What they lose, of course, is client choice, and then they lose the social interaction, which has also really been a positive. So we have mixed reactions. We're trying to figure out, do we customize to each site, or do we have a standard procedure? We're still kind of in the mix of that, of which way to go. Right now, we're kind of in the interim, kind of letting people or sites choose which they think works best. We might have to go to a hybrid though.
Interesting. Thanks for that, sharing that, Sean. Any other thoughts, other folks? Because I've, you know, just anecdotally, I've heard that from a couple other people that, you know, they're not actually getting complaints from folks that they can't go in anymore because, and one of the things that I've heard from folks is that they're seeing more new people come, because I think there's something a little bit to the, I don't have to necessarily go in or have anyone see me or anything. You know, I know there's still some stigma around it in certain communities. So being able to just drive up and drive out has been something that people have wanted still. So anyone else hear anything about that? Okay, Katie Ellis from 360 Community said, we are doing a hybrid model. Each of our 5 sites determine the best schedule based on volunteer coverage and client interest. Okay.
I think it's there are a number of clients that that do feel like it's a social structure, but there are just as many clients that don't want that social interface, that have problems with being that close maybe to folks. They have problems with the fact that there may be children in the area. I think that mix is, you know, 50-50 at the very least, maybe.
Yeah, Greta. So you had a comment in the chat. Our concern here at Manna in Worthington is how much of the food that we have been boxing up for our families is going to waste. In other words, if the family doesn't give it to someone else, does it go in the trash? And Lisa's follow-up is, what method did you use to determine client interest? Survey, conversations?
Hi, Lisa.
Yeah.
I get chime in.
Okay, thanks.
Hi, we did a agency-wide survey of our volunteers to determine their comfort level. And for clients, there is an upcoming client survey in the works. It's taking longer to get the ball rolling than we had hoped, but their interest is mainly based on requests and just anecdotal information from conversations with our schedulers. So it's all kind of wait and see. We'll try this for a while and see if we need to add shopping appointments or, reduce the number of pre-packed orders. So we're just going to try it out for a while and see how it goes.
Thanks, Katie. I just want to call out, there's certainly nothing wrong with anecdotal information or looking at the requests that are coming in. I mean, I think there's a tendency in our sector maybe to over survey people. So I think I'm really pleased to hear that you took client requests and looked into that. I mean, that's a great way to get a sense of what they're wanting to do.
Yeah. And Greta also put in the chat, we're conversing when we go to the car, and we do give them choice shopping. It's more work to keep the list updated, but much better than providing items the family can't or won't use. Totally. And I think that that's something, how do you strike that balance between, with our volunteer capacity, how do we, what are some things that we can pre-pack and what are some things that we can add to choice? Or do we just go to full choice, but have people drive up and maybe point at a menu? Do you have to get that stuff in ahead of time? These are all things that I think, people have been trying out and seeing, and whether or not it's working, and it's just going to be a constant kind of push and pull. Yeah, Lisa, what are you kind of seeing anecdotally just from talking with folks?
Oh, I have to say, I still feel like I don't have a great sense of who else in the East Metro has gone back to in-person shopping, which was right. It was so fun to listen to the folks here who are doing that. But I'm looking at Greta's comment about keeping their shopping list up to date. And Greta, I think you mentioned that you're still using a paper list. I do know Hallie Q. Brown Food Shelf in St. Paul was using a paper list, but I just learned recently about 2 different pantries that are using an app for online ordering. And one of them, in fact, is a small rural pantry in upstate New York. And I did post their story to the Facebook group. And then Trisha Leland or Trowbridge now posted that Du Nord Pantry in Minneapolis is also using an app so that clients can place online orders. And one thing I thought was interesting for the rural pantry is that when there are families that don't have access to a smartphone or a laptop, they have friends who are placing the order for them. So I thought that was an interesting strategy.
That is an interesting strategy. And you said that you posted that in the Facebook group?
Yep, the Second Harvest Heartland Partner Network Facebook group. Yep, I can put the link here too. I'll do that.
Yes, because Tim asked what apps are being used. I don't know off the top of my head, but I know that information is out there. Margaret said we started having one person at a time step into an entryway to pick up a food list, doing outreach, visit with family. This is working too. Our volunteer team is still fully masked per agency requirements. Okay, that's great. Sounds like able to do outreach to folks, still get lists in people's hands and kind of learn what folks are wanting. Andy asked, have facilities that have reopened experienced an uptick in their numbers? Does anyone want to speak to that?
We have at Interfaith, definitely the numbers have gone up, but I don't want to credit that to reopening because we've been reopened for a while. I think you can credit that more to just the vaccinations being rolled out, people being more comfortable.
Great. It could be a little bit of both, right? Maybe people want to go because they hear, oh, we can go and pick food there, but then also I feel better about doing it because I'm vaccinated. Anyone else? Maybe Michelle, if you're still there, have you seen an uptick or the numbers down, steady?
our numbers only went up about 10 families a week, but then it went, so it's stabilized about 10 families a week more than during COVID, but still nothing to our pre-COVID numbers.
Got it. That makes sense. Any other questions for folks? Comments, things people just want to put out there. Thank you, Lisa, for putting all the links in there. Well, if nobody has any more questions or considerations or would prefer to connect with folks offline, that is okay. Know that we will be sending out follow-up and we will be sending out a copy of the transcript and the video recording for this. So if you do want to connect with someone and their email is in the chat, you'll be able to. Otherwise, I think we will wrap up. Number one, Manna Foods. That since June 4th, we've seen 29 more families, 69 individuals come to the pantry that have not been here since the beginning of the years. Okay, wow. So we do see some people having an uptick. That's great to see. But as I was wrapping up, I want to just give you, a couple minutes left back in your day. So please go ahead and reach out to folks. Please stay in contact with us if you are wanting some more ideas about how to open up again, if you're going to do that, if that's even the best fit for you, or you think doing distributions as you have been might be a better fit for you and the folks that you're serving. And just as always, reach out to the network, reach out to us. We're here to support you and the awesome work that you're doing. So thank you very much, everybody. Enjoy your afternoons. Oh, Greta, sneaking in the last minute, one last question. Is EBT dropping back this fall? Does anyone have an answer for Greta? Margaret with a yes. Perfect. What a good note to end on. Thank you, everybody. Take care.
Thanks, Francisco.
Thank you.